Hello everyone, welcome to our channel. Today we're addressing a vital topic related to heart health. We're peeling back the layers on a subject that's often overlooked but can be a matter of life and death. The silent signals of a possible heart attack. These are the signs that can easily go unnoticed but are critically important to be knowledgeable about. Our hearts are the engines that keep us running, and just like any engine, they sometimes give off warning signals before a major breakdown. Understanding these signals can be the difference between timely intervention and catastrophic consequences. It's important to clarify that this video is designed to provide information and raise awareness. It should not, under any circumstances, replace the advice of a medical professional. If you suspect you have heart issues, or if you're experiencing any symptoms we discussed today, don't hesitate. Seek medical assistance immediately. Let's dive into the most common silent signals of a possible heart attack. These indicators may not be as dramatic as you'd expect, but they're just as important to recognize. Firstly, chest pain is a common sign. This isn't always a sudden stabbing pain. More often, it's a discomfort which could feel like a tight band around the chest or a heavy weight sitting on your chest. Sometimes this pain can radiate, moving from your chest to your left arm or even your jaw. Next, shortness of breath. You might find yourself gasping for air or feeling like you've just run a marathon even though you haven't moved. This breathlessness can occur before or during the chest pain of a heart attack, so it's important not to dismiss it. Nausea or vomiting can also be indicators of a heart attack. These symptoms are often mistaken for food poisoning or a stomach bug, but if they're accompanied by any other heart attack symptoms, they should not be ignored. Excessive sweating is another silent signal. You might suddenly break out in a cold sweat for no apparent reason. This isn't about sweating due to exercise or temperature, but rather a sudden, unexplained sweat that could even make your clothes wet. Lastly, unusual fatigue. You may feel extremely tired not due to physical exertion, but a fatigue that's disproportionate to your activity levels. This isn't just about feeling tired, it's an overwhelming sense of exhaustion that's hard to explain. These are the common symptoms that we often hear about, but there are lesser-known silent signals too. It's crucial to remember that these symptoms can present themselves in different combinations for different people. If you or someone around you experiences any of these symptoms, it's critical to seek medical attention immediately. In the realm of heart health, time is of the essence, and every second counts. Let's discuss some lesser-known silent signals. When we think about heart attack symptoms, chest pain or shortness of breath may first come to mind. But there are other, less obvious signals that can indicate a possible heart attack. These lesser-known silent signals could be just as important to recognize. Take dizziness or fainting, for instance. These symptoms can occur as a result of reduced blood flow to the brain, which may be caused by a compromised blood supply to the heart. If you notice sudden spells of dizziness or instances of fainting, don't brush them off as simply being due to fatigue or stress. They could be signaling something much more serious. Next, let's talk about back or neck pain. While these pains are commonly associated with posture or muscle strain, they can also be a symptom of a heart attack. In some cases, the pain isn't confined to the chest area. It can radiate outwards, affecting the back, neck, or even the jaw. So if you experience unexplained persistent back or neck pain, it's a good idea to get it checked out. Lastly, gastrointestinal symptoms like stomach pain or indigestion can also be associated with heart issues. It may be surprising, but the heart and the stomach are connected by a complex network of nerves. Sometimes, a problem in the heart can send signals that are felt in the stomach. So if you have persistent stomach pain, indigestion, or even nausea and vomiting that doesn't seem to be related to something you ate, it might be your heart trying to tell you something. In conclusion, while these symptoms might not seem directly related to the heart, they could be quietly signaling a possible heart attack. It's vital to listen to your body and seek medical attention if you notice any unusual or persistent symptoms. All these symptoms could indicate a possible heart attack. So, what should you do if you recognize any of these signals? First and foremost, it's crucial to act quickly and decisively. If you suspect you or someone around you is experiencing a heart attack, don't hesitate. Dial your local emergency services immediately. Every second counts, and the sooner you get medical attention, the better the outcome is likely to be. Now, it's important to remember that these symptoms may seem mild or vague, but that doesn't mean you should ignore them. Even if you're not certain, it's better to seek help and have it turn out to be a false alarm than to dismiss potentially life-threatening symptoms. While you're waiting for help to arrive, it's vital to stay as calm as possible and try to rest. This might seem challenging, especially in such a stressful situation, but remember that stress and activity can worsen the situation by putting additional strain on your heart. Find a comfortable position, focus on your breathing, and try to relax. What about taking medication? Well, while it might be tempting to reach for an aspirin or another over-the-counter drug, it's generally best to avoid self-medicating in this situation. Some medications could potentially worsen your condition or interfere with the treatment provided by the emergency medical team. So in summary, act quickly, don't ignore even mild symptoms, try to stay calm and rest, and avoid self-medicating. These steps can make a significant difference in a critical situation. Of course, it's also worth mentioning that these measures are for emergency situations. If you're experiencing milder chronic symptoms or have a history of heart disease, it's important to consult your healthcare provider for advice tailored to your specific situation. Remember, it's important not to ignore these symptoms and seek immediate medical help. The quicker you respond to these signals, the better your chances of survival and recovery. It's a matter of life and heart. Scene script. Prevention is always better than cure, especially when it comes to heart health. One of the most effective ways to keep your heart in good shape is by embracing a healthy lifestyle. A well-rounded diet packed with fruits, vegetables, lean proteins, and whole grains can do wonders for your heart health. Make sure to limit your intake of saturated fats, trans fats, and cholesterol while increasing your consumption of fiber, which can help lower your risk of heart disease. Regular physical activity is another crucial component of a heart-healthy lifestyle. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could be a brisk walk, a bike ride, or even gardening. Remember, every bit of movement counts. Managing stress is also important. Chronic stress can lead to behaviors and factors that increase heart disease risk, such as high blood pressure and cholesterol levels, smoking, physical inactivity, and overeating. Some healthy techniques for stress management include yoga, meditation, and deep breathing exercises. In addition to a healthy lifestyle, regular medical checkups are vital in the prevention of heart diseases. These checkups allow your doctor to keep an eye on your blood pressure, cholesterol levels, and glucose levels. Regular screenings can help detect potential problems early, when they're easier to treat. If you're a smoker, quitting is one of the best things you can do for your heart. Smoking is a significant risk factor for heart disease. The chemicals in tobacco can damage your heart and blood vessels, leading to narrowing of the arteries, which can ultimately lead to a heart attack. It's never too late to quit, and the benefits start immediately. Last but not least, moderate your alcohol intake. While moderate drinking can have some heart benefits for some people, it's not for everyone and can be harmful in some cases. Always consult your doctor on what's best for you. Ensuring these preventive measures can help maintain a healthy heart. It's about making choices every day that keep your heart healthy, your body strong, and your life filled with vitality and joy. After all, your heart is worth the effort. To wrap up, heart health is crucial, and knowing the silent signals of a possible heart attack can make a difference. We've journeyed through the less trodden paths of heart health, uncovering silent signals of a heart attack that are often overlooked. From chest pain and shortness of breath, to lesser-known symptoms such as dizziness and gastrointestinal issues, we've shed light on the importance of recognizing these signs and taking them seriously. Alongside this, we've emphasized the importance of seeking timely medical assistance, even if symptoms appear mild. Remember, every moment counts when it comes to heart health. We've also touched on the key preventive measures: a balanced lifestyle, regular medical checkups, and quitting smoking, as they are the first line of defense against heart disease. Thank you for joining us today. Remember to share this video with those who may benefit. See you in the next video.